Hello viewers. Welcome to Dental Digest. Here are 10 important things you should remember while tooth extraction. Got your tooth extracted? I knew. That's why you are here. Here are 10 important things you should avoid after tooth extraction. Tooth extraction is a complex process where the dentist removes the tooth along with its root. It is a traumatic procedure which deals with a lot of blood. Fortunately, advanced dental procedures have simplified tooth extraction and have made it a painless procedure. It includes removing the tooth, which contains both crown and root, or removing the entire root, which was left after the destruction of the tooth. During a tooth extraction, your dentist might inject a local anesthetic solution into the area of tooth extraction. In simple words, your dentist might desensitize or numb the area of tooth extraction with local anesthesia. After waiting for a few minutes, he may ask you whether your teeth and gums have become numb. After confirmation, he or she may start the procedure of tooth extraction. Your dentist may use simple elevators if the tooth is mobile, or might use extraction forceps if the tooth is firm to remove your tooth. In the case of wisdom tooth extraction, your dentist might cut the bone while removing the impacted tooth. Moreover, he may place few sutures while closing the gums. The healing process is the same for any type of tooth extraction. Initially, the blood in the extraction site should clot. After few hours the clot stabilizes. Later the clot forms into a structure called callus, which is a primitive bone. Later the callus mineralizes into bone. The entire process takes few weeks to months. In the meantime, the gums above the extraction site heal completely and would form a cover over the underlying extracted site, preventing any food impaction. Here are the 10 important things you should consider not doing after tooth extraction. Point 1. Never remove the cotton immediately after extraction. Cotton should be kept in the extraction site under pressure at least for half an hour to an hour. Once the bleeding stops and clots form within the extraction socket, remove the cotton. Point 2. Do not spit after tooth extraction. Every time you spit, you are indirectly mobilizing the clot within the extraction socket. As a result, the clot will not be stabilized, and fresh blood oozes out of the extraction socket. It may result in huge blood loss. Point 3. Never touch the extraction site with your finger or tongue. It is a general human tendency to examine the extraction site with your finger or tongue. Never do that. You might indirectly infect the socket with your tongue or finger. Leave the extraction site and never try to examine with your finger. Frequent disturbance over the extraction site may destabilize the clot and infect the socket. Point 4. Avoid carbonated drinks for at least 1 day. Carbonated drinks destabilize the clot and may hinder proper healing of the extraction socket. Point 5. Avoid spicy or hot foods for 2 days. It is a best practice to be on a bland and cold diet for 2 days after tooth extraction. Hot and spicy food may aggravate pain and burning sensation in the extraction area. Point 6. Do not avoid medication if your dentist advises. Medication helps in the proper healing of the socket and prevents secondary infection. Even though you feel better after the first day of extraction, continue medication for the prescribed duration. We may not know when the scenario may turn down upon. Point 7. Never apply pain balms of sprays over the extraction socket. In case of pain after extraction, consult your dentist for medication. Never apply pain balms of volatile oils over the extraction socket. It may lead to space infections which might turn life-threatening. Point 8. Never stop brushing after tooth extraction. Regular brushing aids in removing debris over the extraction site. Of course, mild brushing should be done on the extraction site on the first day, but from the second day onwards, brushing should be normal. An unhygienic environment in the mouth may lead to secondary infection of the socket called a dry socket. Point 9. Never apply hot fermentation over the extraction site. Hot fermentation might increase edema in the socket area and can lead to facial swelling. Always apply a cold pack over the extraction site if advised by your dentist. Point 10. Do not sleep with your head turned onto the extraction site. For example, if you got your teeth extracted on the left side, do not sleep with your head turned to the left side. It may attract edema, and your face may swell in the morning. Minor extraction procedures may not show a big impact, but patients who have undergone wisdom tooth extraction should definitely avoid this. What should I do if I have pain after tooth extraction? Pain after a tooth extraction is usual. The healing gums and bones become inflamed and may produce pain. But the pain is of mild intensity and will relieve within 1 or 2 days. But consistent severe pain even after tooth extraction should not be neglected. In case of severe pain, visit your dentist and find out the possible cause of the pain. Severe pain might be a sign of secondary infection after tooth removal. It might require medication and additional treatment procedures. Usually, patients with secondary socket infection might have pain after tooth extraction. Such a condition is called dry socket. What is the exact healing time after tooth extraction? It takes a week to 10 days for the gums to heal. But the socket inside the gums may take more than 3 months to heal. The socket has to heal from the inside. Hence you may experience a bony defect in the extraction region even after months. But do not worry, your socket is healing from inside, and hence may take some time to fill the defect. If non-resorbable sutures are placed, they should be removed after 5 days, when the gums heal. If resorbable sutures are placed, they heal along with gums, and disintegrate in due course. Hope you understood the precautions you should take after tooth extraction. Follow these few rules, and you will have a safe and happy healing after tooth extraction.